You're listening to Taking Stock with Kathleen Hayes and Pim Fox on Bloomberg Radio.
Utilizing artificial intelligence as a foundation to create the next generation of drugs and diagnostics, and maybe to find a way to beat back some of the most deadly cancers. That is what Berg is doing. They are based in Boston. Their co-founder, president, and CEO is Niven Narain, and he joins us now to talk about their revolutionary drugs and how they've created them. Welcome to the show.
Hi, Kathleen. How are you? Great to be on.
Well, it's great to have you. I think anything that has to do with fighting cancer, and particularly this new way of targeting therapy to the cancer itself, to the tumor itself, has been tried in a lot of different ways. What exactly is Berg doing now?
Yeah, so our approach is really to take a look at the overall systems of the tumor. So not just focusing on one specific mutation that may be associated to tumor. You know, if we just step back for a second, cancer is a very complicated disease, and I think to just look at cancer. There are some cancers that has a very neat mutation, like a HER2-positive breast cancer. So in that case, I think the approach is justified. But in most cancers, there's a term that's called a heterogeneous, which means there's a group of populations that make up that tumor. So just by tackling cancer on one mutation, I think it could be problematic. So what Berg is doing is looking at that cancer in all its states. It's looking at the cancer genetics. It's looking at the microenvironment. It's looking at the things, the proteins, but importantly, the elements that comprise both the tumor and that person's environment and the localized tissue, because it's really important to understand the area around that tumor and how that affects the growth of that tumor and potentially even the capability of that tumor to metastasize. So by using the combination of technologies and taking a back to biology approach, where we take the sample of the tumor, we take the sample of the patient, and we're able to understand that interaction. And by understanding that interaction, we then use artificial intelligence, which helps us parse through a voluminous amount of data both on the patient and the tumor. So we're able to understand a healthy versus a disease environment and develop drugs that are changing the disease process back to that of the healthy state.
Niven, I wonder if you could tell us about precision medicine and why is now the time in which this is moving to the forefront? Does it have to do with things like sequencing the human genome, biomedical analysis, being able to go through large amounts of data? What exactly is precision medicine?
So I think that precision medicine has become at the forefront in health sciences and pharmaceuticals because we just have to. There's a significant need to firstly understand patients because for a long time drugs have been developed by screening of chemicals that creates a one-size-fits-all approach. So as it is even today, everybody gets treated the same way. Let's just use the example of a pancreatic cancer patient. It comes in with and they're all diagnosed with pancreatic cancer. So drugs are approved by the line of therapy. So everybody's going to get that same drug, but obviously we're not all the same. We don't have the same biology. So the definition of precision medicine is really treating the right patient with the right drug at the right time. And for us to be able to do that, we have to understand the biology. And Berg, for a long time, since the company was founded, we have prided ourselves on taking a back-to-biology approach. Before we start any pharmaceutical discovery, we want to understand the patient biology first.
Okay. Niven, I want to ask you about BPM 31510, a drug that fights some of the most deadly cancers.
Yes. So the approach of the Berg cancer technology is to fight cancer at the core state of its metabolism, which is switching the fuel that a cancer cell likes to operate on. So cancer makes a deal with the underlying healthy environment to say, that the cancer will, in exchange for being less energy efficient, will evade the ability to undergo cell death. So obviously these tumor cells keep growing and growing infinitely. But what the Berg cancer drug does, there's a naturally occurring enzyme in the mitochondria. When it's reintroduced into mitochondria, which is the powerhouse of the cell, it turns on the energy and machinery in the mitochondria in a sense that allows the cancer cell to behave like a normal cell again. So it switches the fuel that cancer likes to operate on back to that of that allows the breakdown of glucose, and so by doing that, the cancer cell behaves much like a healthy cell and regains that ability to undergo cell death.
Thank you very much for spending time with us and explaining the world of precision medicine. Niven Narain, he is co-founder, president, and chief executive of Berg Health. You're listening to Taking Stock. I'm Pim Fox, my co-host Kathleen Hayes, and this is Bloomberg Radio.